Good afternoon, everybody. Namaskaram Andarki. My name is Syed Amjad. I am the Center Manager of Origin Fertility Center. We are here for the launch of Repeat IVF Clinic. I hereby call upon our Director, Dr. Rinki Tiwari, to take the stage.
Good afternoon all. I am Dr. Rinki Tiwari, Founder and Clinical Director of Origin Fertility Clinic and Research Center. We welcome you all on the launch of Repeat IVF Failure Management Clinic. So this is a novel initiative started by Origin Fertility to help those couples who has lost their all hopes after repeated failed IVF. Even one failed IVF can be devastating and frustrating for any couple, even for the doctor. After repeated failed IVF, sometimes people they go at the at the peak of their depression. Sometimes they go for at the peak and they go for the adoption also. They reach at that stage. And why we thought okay we should start this clinic, because just for information, yesterday only we celebrated our second anniversary. So in these 2 years we have been seeing these kind of cases, so many. Means those patients they have previously they had 3 failed IVF, some patients they had 5 failed IVF, and we were be able to do justice with them. And because when those cases had come to, we consulted immunologists, we had discussion with andrologists, embryologists, and then with multi-disciplinary approach we have treated those cases, and by God's grace we have given success to those cases. So then we thought okay why not, we should start this initiative, and that will be definitely helpful for those couples who are struggling in silence and they have lost their all hopes, and they have come at the age of refusal for the treatment also. So it's a novel initiative by Origin Fertility. Let's hope that we can do something good for the society and especially for those patients. With clinical advancement, the IVF success rate has reached up to 40 to 50%. That means in every IVF case, there are 50 to 60% chances are there that failure chances will be there. And according to definition, if you see what is repeated IVF failure, so if the couple has 3 failed IVF, then it will come in the category of repeated IVF failure. The percentage of repeated IVF failure is around 15%. So how we were able to deal with these kind of cases, if you ask me, with the latest technologies available in the embryology side, like we can go for PGS. In these cases PGS will be very helpful. Unfortunately our embryologist is not available today because he held up with some important work. I will just say something about PGS. Means it's a technology, through that we do the biopsy and we can analyze okay this embryo is normal or not. So if the embryo is normal, then only that embryo will be able to give the pregnancy. That is called euploid embryo. So by PGS we can see that, and other chromosomal, very latest chromosomal analysis, chromosomal test also available. For example, NGS techniques based some tests are available. So those tests will be very helpful, and sometimes immunological factors also responsible for this repeated IVF failure. Like sometimes maternal autoantibody only will be rejecting the normal fetus. So if we include the immunologist in the team, so then we can do justice with the patient, and we always keep on updating ourselves. I have been to ASHRI conference Italy last month only, so there also on this lot of discussion was going on, because in infertility if you see what is the still last barrier in infertility is implantation. Means this is the repeated IVF failure or recurrent implantation failure. This is the still unsolved topic in infertility also. So a lot of research keeps on coming on that. So in Europe also I was able to see a lot of new updates on that. Okay, how we can improve the endometrial receptivity, how we can improve the how we can use genetic testing for that, and how we can do justice with the patient. So let's hope for the best. And here even our success rate for treating these kind of cases are very good. And I'm not telling ki we were able to do justice with all cases, but yeah, if you ask me ki till now we have more than 3 failed IVF. We have dealt almost 12 cases here. Out of 12, 10 cases were successful. Out of 12, 10 cases were successful. We have given pregnancy to more than 100 couples in these 2 years with IUI and IVF both. And then around 12 cases we have got like that ki those have 2 failed IVF, 3 failed IVF, and 1 patient treatment also going on, 5 failed IVF. So because of privacy issue, I cannot reveal the name, and but still I can give you some numbers. Like we were somehow we were able to do justice with these kind of cases. Causes of infertility, there are various causes of infertility. If you only infertility, if you see male infertility causes like sperm parameter, abnormal sperm parameter, if motility issue, morphology issue, sperm count issue, and sometimes their DNA fragmentation index will be high. And female infertility may like low ovarian reserve, endometriosis, PCOS, like sometimes because of lifestyle, obesity. If we give them little advice, then also it can be it can help them without any medicine. So few cases we have treated like that also. Not repeated IVF failure, but general fertility. In repeated IVF failure, if you ask me what is our USP in treating these cases, one is we have one of the, I'm not telling ki we have best, but we have one of the best world class lab. So because we have never compromised with the quality of lab. So one of the, because we are taking out cells from the body, that egg and sperm. So we have to give the best environment in the lab. That is why lab environment is very, very important. So in that we never did compromise. And then we have team of experts, like we always keep on updating ourselves. That is our USP. And then in these kind of cases, I have taken help of immunologist also. I have taken help of geneticist also, and then andrologist and embryologist. So multi-disciplinary approach we have used in treating these kind of cases, because these kind of cases they need special care. Only we cannot treat them just like other cases. We have to individualize the protocols for them, and then we will be able to do justice with them. Always what I always believe ki whenever any IVF fail, then you are going for second IVF. Your success key always will be in the first failed IVF. You have to find out. You have to find out okay, why previous IVF was failed. What was the reason? Was there any reason was there? Or was the previous IVF was done properly or not? That also we have to see. I'm not telling most of the doctors, they always do their best, but sometimes few things can be missed by anyone, even by me also. Anyone can miss, and then we have to analyze it properly. Okay, maybe DNA fragmentation could be the issue which we didn't check in previous IVF. So like that we have to analyze first, and then we have to individualize the protocol for them, and we have to give the best possible treatment for them. A lot of studies has done ki okay, maximum how many IVF the person can go. Few studies say something, but approximately around till 7 IVF patient can go safely. There is no chances of ovarian cancer also. After that, there is no clear data available, but there can be chances of ovarian cancer after 7 to 10 IVF, but no clear data is available on that. In 2 years period, our success rate is like around 65 to 68%.
నేను డాక్టర్ వి ఉమాదేవిని మాట్లాడుతున్నాను. యాక్చువల్లీ నేను ఈ ఆరిజిన్ టీంలోకి ఒక 2 months అయింది వచ్చి. ఇక్కడికి వచ్చిన తర్వాత అంటే బిఫోర్ నేను ఇక్కడికి రాకముందు కూడా ఇక్కడ ఈ డాక్టర్ రింకీ ఎస్ తివారీ మేడం గురించి కనుక్కొని ఐ కేమ్. యాక్చువల్లీ పర్సనల్గా నేను ఎవరిని కలవలేదు, బట్ దెన్ గూగుల్ రివ్యూస్ చూసి అంటే ఎవరన్నా ఒకరన్నా నెగటివ్ కమెంట్ ఏమన్నా పెడతారేమో అని చూశాను. బట్ ఎక్కడ ఎవరు నెగటివ్ కమెంటే లేకుండా అందరూ 5 stars ఇచ్చారనమాట. సో ఐ థాట్ నేను ఇక్కడ మేడం తోటి కలిసి పనిచేస్తే బాగుంటుంది అని నేను మేడంతో జర్నీ స్టార్ట్ చేశాను. ఇక్కడికి వచ్చిన తర్వాత చాలామంది కపుల్స్ కలిసాను నేను. కలిసిన తర్వాత వాళ్ళని హిస్టరీ తీసుకోవడము అండ్ వాళ్ళు ఎలా ఫీల్ అయ్యారు ఇక్కడికి వచ్చిన తర్వాత అని కనుక్కుంటే అంటే ఎవ్రీవన్ అంటే వాళ్ళు అందరూ వేరే వేరే క్లినిక్స్ ఐవీఎఫ్ సెంటర్స్కి వెళ్ళి ఇక్కడికి మా దగ్గరికి అప్రోచ్ అయ్యారనమాట. ఇక్కడికి వచ్చిన తర్వాత వాళ్ళు సక్సెస్ అయ్యి వాళ్ళు చాలా హ్యాపీగా ఫీల్ అయ్యారు. అండ్ వాళ్ళు హ్యాపీగా ఫీల్ అయ్యింది కాకుండా అండ్ హూఎవర్ అంటే మనకి చుట్టుపక్కల చాలామంది ఐవీఎఫ్ ఫెయిల్యూర్ అయ్యి వాళ్ళు అంటే ఇంకా క్లినిక్కి వెళ్ళకుండా బాధపడుతూ ఇంట్లోనే ఉన్న పరిస్థితులు ఉన్నాయి ఇప్పుడు కపుల్స్లో. అయితే అలాంటి వాళ్ళకి ఇప్పుడు రిపీటెడ్ ఐవీఎఫ్ ఫెయిల్యూర్ క్లినిక్ మేనేజ్మెంట్ అన్నది ఇప్పుడు ఒకటి స్టార్ట్ చేసాం ఇక్కడ. సో వాళ్ళు అంటే వాళ్ళకి ఇంకా హోప్ ఉంది, వాళ్ళు అలా డిప్రెస్ అవ్వకుండా ఇంట్లో ఉండద్దు, ఇంట్లో ఉండకుండా ఒకసారి మా దగ్గరికి వచ్చి అప్రోచ్ అయితే ఐ థింక్ వాళ్ళకి కొంచెం బెటర్ ట్రీట్మెంట్, బెస్ట్ ట్రీట్మెంట్ ఇవ్వడానికి మేము ట్రై చేస్తాము ఇక్కడ.
Well, I'm Dr. Rinki Tiwari, Clinical Director and founder of Origin Fertility Clinic and Research Center, Hyderabad, Hyderabad. So, welcome to the launch of Repeat IVF Failure Management Clinic. It's a novel initiative by Origin Fertility to help those couples who have lost their all hopes after repeated failed IVF. As we know, even one failed IVF also can be devastating and very frustrating for the couple as well as for the patient. As we are seeing that over the last few years with the clinical advancement, the IVF success rate has reached up to 40 to 50%. But still means with each IVF there are chances of 50 to 60% of failure of IVF. According to definition, if you go then any couple, if they are having 3 or more failed IVF, that is called repeated failed IVF. But these we cannot wait for for them to fail for 3 failed IVF. And then in these kind of patients they need multi-disciplinary approach, they need special care, they need individualized treatment protocols. So we are here to help them. We have team of we have included the immunologist, embryologist, andrologist and geneticist in this team to help those couple. And so why we thought okay we should start this clinic, because yesterday only we celebrated our 2nd anniversary, so it's been two years since we have started. And in these 2 years, if you ask me how many cases I have seen, around 10 to 12 cases I have seen these kind of patients, like they had 3 failed IVF, 5 failed IVF, and somehow we were able to do justice with them. And how we did justice with them, if you ask me, then our USP is like our one of the best world class IVF lab. We never compromised in that, and we used a lot of latest technologies, like we use microfluidics, and some patients they needed PGTA, means genetic screening, and then we took some chromosomal analysis also there, like NGS techniques based chromosomal analysis, and then we took opinion of our immunologist also, and together we have dealt with these kind of cases, and by God's grace we were able to do justice with those patients. So then we thought okay, why not we should start this clinic to help those couple, and we just want to tell them that we are there for you, and we will try our best. We are not telling you we will always be successful, but we are getting good results with that. So that's why we thought to start this. And because if you ask me what is the cause of repeated IVF failure, these all only are the causes, like immunological factor, sometimes male factor which was not diagnosed properly, and sometimes their DNA fragmentation index was high. And so we have dealt with this kind of cases, and then that's how we were able to do justice with them.
నా పేరు శివానంద్ అండి, సీనియర్ ఎంబ్రియాలజిస్ట్, ఆరిజిన్ ఫర్టిలిటీ, హైటెక్సిటీ. రిపీటెడ్ ఐవీఎఫ్ ఫెయిల్యూర్ గురించి మేము ఈరోజు కొత్తగా స్టార్ట్ చేసామండి. సో హూఎవర్ అంటే ఐవీఎఫ్ పేషెంట్స్ ఎవరెవరు అయితే సక్సెస్ఫుల్ అంటే 3-4 సైకిల్స్ ఫెయిల్ అయిన వాళ్ళు ఎవరైతే ఉన్నారో వాళ్ళు మా దగ్గర వచ్చారు. సో మా సక్సెస్ రేట్ బాగానే ఉంది, బికాజ్ ఇప్పుడు లేటెస్ట్ టెక్నాలజీ ఏదైతే ఉందో వీఆర్ యూజింగ్ దాట్, లైక్ మైక్రోఫ్లూయిడిక్స్ అని టీజా కానివ్వండి ఏదైనా అది యూస్ చేసి కొంచెం సక్సెస్ రేటు అంటే అట్లీస్ట్ 64% సక్సెస్ రేట్ ఉందండి మా దగ్గర. సో చేస్తున్నాము అంటే ఒక్కొక్కసారి కొంతమంది పేషెంట్స్కి బ్లాస్ట్ ఫామ్ కాదండి, డే 5 వరకు కల్చర్ చేస్తాము, అంటే ఎక్సీ చేస్తాం మేము, అంటే స్పర్మ్ మూసైట్ కలుపుతాము, బట్ బ్లాస్టోసిస్ట్ ఫామ్ కాదనమాట. సో దానివల్ల ఫెయిల్యూర్ ఉంటుంది. కొంతమందికి బ్లాస్టోసిస్ట్ వస్తుంది కానీ ఇంప్లాంటేషన్ అవ్వదు. సో ఇంప్లాంటేషన్ మల్టిపుల్ సైకిల్స్ ఫెయిల్ అవుతూనే ఉంటాయి వాళ్ళకి. సో దానివల్ల మనము పీజీఎస్ కూడా వెళ్ళొచ్చు, దట్ ఈస్ ఇప్పుడు లేటెస్ట్ టెక్నాలజీ, అది పీజీటీఏ అంటారు. సో దాంట్లో మనం చూడొచ్చు అనమాట, అంటే వాట్ ఈస్ ద రీజన్ ఇంప్లాంటేషన్ ఫెయిల్యూర్ ఎందుకు అవుతుంది.
And mostly we are doing day 5 transfer, because now with latest technology and advanced lab environment, we are able to culture embryo till day 5. Previously we used to culture embryo only till day 3, because till day 5 we culture embryo, so we were not not way means people never used to get anything most of the time, not never. So now because of latest technology we are able to do day 5, we are able to culture embryo till day 5. So mostly we prefer day 5 transfer, but in few cases day 3 transfer also gives success, but mostly at our center we do day 5 transfer.